proportion of infections are caused by Canadians coming back to the country. That being said, let me be clear. Every case is a case too many. Let me repeat. This is not the time for traveling, especially during the upcoming break week. All options are on the table, and we will be announcing new measures very soon. So please avoid all non-essential travel, be it abroad or to another province. Cancel your travel plans to the south. There will be other opportunities for you to travel during more pleasant times for you when the pandemic will be under control. I know that the times and the winter are getting long, but please let's continue hanging on.
Strictest travel and border measures in the world. We've closed the borders since March to everyone for whom Canada is not home. We have a 2-week quarantine for everyone returning to the country, and we now have a mandatory negative test before flying home. These measures work. They're saving lives. And that's why our friends and allies are following suit. Just take the United States, where they've recently adopted the same requirement for a negative test before flying back into the country. We are doing whatever it takes to keep Canadians safe. As I've said before, when it comes to protecting you and your family, nothing is off the table. We will not hesitate to take even tougher measures if and when they're needed, and we'll be making an announcement in the coming days. The bad choices of a few will never be allowed to put everyone else in danger. Of course, travel is only one part of the equation when it comes to beating COVID-19. Fighting this pandemic also means we need the tools to test and trace the spread of the virus right here at home. In the last week alone, we've delivered over 1 million rapid tests to the provinces and territories. That brings us to 15.4 million rapid tests that we've sent out to the front lines, and even more are on the way. Le dépistage est essentiel.
Testing is critical to fight COVID-19 and to be in the best possible position when mass vaccination starts in the spring. We are doing everything we can do to help you and your family overcome the crisis. But we cannot do it alone. We also need you. I've talked about travelers before and the strict border measures being imposed. Let's not forget that it's mostly community transmission that is continuing to spread the disease. There are people who have become an exception to the rule, and unfortunately, because of that, cases are increasing. Hospitals are being overloaded, surgeries are being postponed. We must do whatever we can, what must be done to follow public health advice. Stay at home. Avoid meetings, wear your masks, and download and use the Alert COVID application.
Been on the front lines of this fight against COVID-19 for almost a year now. They know how far we've come, and they know that we need to keep going just a little longer. To our doctors, nurses, and long-term care workers, thank you. From Victoria to Iqaluit to St. John's, you're taking care of our parents, grandparents, and friends. Right now, you're working longer hours than ever. You are our heroes. Your service and dedication every day is remarkable. De nouveaux défis vont émerger.
New challenges will emerge during these uncertain times, but I know that together we are ready to confront them. This morning, I had a call with the CEO of Moderna, who confirmed one more time that the contracts we signed with them will be respected. Furthermore, as planned, by end of March, we will also receive about 4 million doses of the Pfizer vaccine. By September, all Canadians who want to be vaccinated will receive a vaccine. The vaccines are sure and effective, and we're working hard for them to be rolled out as quickly as possible.
It'll only be January, but this winter is already turning out to be a long one. And for many business owners who are worried about how to get through to better days, I know that spring and summer seem a long way off. When this pandemic started, we made a promise that we'd be there for Canadians. And every day since, we've done exactly that. Our government has rolled out the largest economic measures in Canada's history to support small businesses across the country, from the Canada Emergency Business Account to the wage subsidy. But even with this help, during a second wave, things are tough. For many businesses and their employees, it's hard to get back on their feet. That's why we're now partnering with Canada's largest financial institutions to introduce the new Highly Affected Sectors Credit Availability Program, or HASCAP. Through HASCAP, Canadian-based businesses that have been hardest hit by the pandemic will be able to receive low-interest loans of up to $1 million. These are 100% Government of Canada-backed loans and can be used for rent, utilities, and help with payroll. Later today, Minister Ng will have more details to share about the loans, including how to access this support once applications open on February 1st. Pendant qu'on aide ceux qui sont le plus
While we are helping those who are most affected by this crisis, we need to think about the future. As vaccines continue to arrive, there is hope in the horizon. Together, we will be able to rebuild a stronger and more resilient economy where everyone has a chance of succeeding, an economy with good jobs so that employees could support their families in a safer and proper environment. We have work to do ahead, but I know that together we can make it. Thank you. Thank you, Mr. Prime Minister.
The phone today with one question, one follow-up, une question, une sous-question. Opérateur, c'est à vous.
Thank you. Merci. First question, Marika Walsh, the Globe and Mail, line open.
Good morning, Prime Minister. Thanks for taking our questions. I'm wondering if you can very clearly explain to Canadians the impact of Europe's threats around export transparency or blocks of vaccine exports or other limits on vaccine exports, what impact that will have on Canada's vaccine supply.
Over the past few weeks, I've spoken with executives at both Pfizer and Moderna who have assured me that we are very much continuing to be on track for receiving our full doses of vaccines in the timelines provided. That is a full 6 million of doses from Pfizer and Moderna by the end of Q1, the end of March. And we are extremely confident we will be able to have everyone vaccinated who wants it in Canada by September 2021. We will, of course, continue to work closely with our European allies and counterparts to ensure that there are not any disruptions to the Canadian supply chain, but Canadians can rest assured that we are working diligently every single day to get as many doses to Canadians as quickly as possible.
Answer repeated in French. Over the past few weeks, I have spoken with the executives of Pfizer and Moderna and those in Europe to confirm that we will be receiving all doses that were promised, all doses for which we signed contracts. That is the 6 million doses by the end of March, and all necessary doses, all doses necessary to vaccinate Canadians who so desire by September. We will continue making sure that our supply chains remain uninterrupted. We shall, of course, continue working with our partners in Europe to make sure that the contracts signed by Canada be respected.
Yeah, the protectionist measures, though, that have been floated by Europe have come since your discussions with the CEOs of Moderna and Pfizer. Can you say definitively that our contracts with the vaccine manufacturers protect us from the European protectionism?
I'm happy to correct you on that one, Marika. I spoke to the CEO of Moderna about an hour and a half ago. So the topic of the recent musings by Europe certainly came up. And it was very, very clear that the Canadian contracts that have been signed and the delivery schedule laid out will be respected.
Merci. Opérateur, prochaine question au téléphone.
Thank you. Merci. Prochaine question, l'inaudible, la presse canadienne.
Next question, La Presse Canadienne. Good afternoon, Mr. Trudeau. I would like to explain why we have to wait before you announce these new measures to discourage travel. You said that there will be new measures. What is delaying those measures? Answer. First of all, we need to understand that Canada has already implemented some of the strictest measures to discourage international travel. When you look at our peers, since March, non-Canadians were prohibited from traveling to Canada. Our borders were closed to foreign travelers. Only Canadians and permanent residents could come to Canada, and this measure has been in force for close to a year. Furthermore, at the same time, we imposed an obligatory quarantine for all those coming into Canada. These measures protected us a lot over the past year. A few weeks ago, we announced new measures requiring a negative test within the 72 hours before boarding to come back to Canada. Taken together, all these measures are amongst the strictest in the world. Even with a very small level of importation of cases, one case is one too many. And with the concerns we have now with the variants that are everywhere in the world that we want to prevent from taking hold here in Canada, we are now looking for ways of once again improving the measures we've already implemented. We already have very strict measures. We want to make sure that the additional measures will be the good ones, the right ones, because we know very well that we depend on planes coming from everywhere in the world for our food, for our pharmaceutical products, for the delivery of essential goods. And we do not want to interrupt supply chains that Canadians depend on. So we are closely studying what other additional measures we can take to add to the already strict measures we have. So we'll be making announcements very soon about that. We are working on that very hard at the moment.
Is that Canada already has some of the strongest travel restrictions in the world. As of last March, non-Canadians, non-permanent residents, aren't allowed to travel to Canada. There is a travel ban for all foreign travelers. That's something that we put in March and very much remains in place. On top of that, we brought in a mandatory 2-week quarantine, which is a measure that many of our allies didn't bring in, and that has been extraordinarily effective over the past year at keeping the importation of cases extremely low. But obviously, extremely low is still not zero, and one case is too many if we're importing, particularly given the variants out there. So as of a few weeks ago, we brought in a new measure that the United States is copying and that others are taking on, which is to demand a negative test in the 72 hours before getting on board the flight back to Canada. Because we already have some of the strongest measures anywhere, we have to be very careful as we move forward on even further measures. One just has to remember that we are reliant on supply chains from around the world for food, for goods, for essential medications, and we do not want measures that we have we're going to be bringing in to further restrict non-essential travel to have an impact on those essential supply chains. That's why we're working very carefully and very diligently on the new measures we will be bringing forward in the coming days to make sure that we are further discouraging non-essential travel, that we are further keeping Canadians safe, but we are not bringing in hardship around our supply lines.
En suivi, Lina?
Follow-up question, Lina? Thank you. I'd like you to better explain your comments on the supply chains. Are you saying that airlines are saying that if we have even less passengers than we have now, there will be an impact on the transportation of goods that we need for the supply chains? Answer, we know that many of the planes are commercial planes and they have passengers, and on board those planes, goods are also transported. So we shall be looking at possible impact on our supply chain.
We know that many commercial flights transporting passengers also carry goods in the belly of those planes. We need to make sure that we are not interrupting our supply line as we strengthen those measures.
Merci, opérateur. Dernière question au téléphone.
Last question on the phone.
Thank you. Merci. Prochaine question, Boris Proulx, Le Devoir.
Boris Proulx, Le Devoir. Good afternoon, Mr. Prime Minister. Still concerning travel, I would like to know if you feel it's too complicated to restrict non-essential travel, if it's going to have an impact on Canada's activities. Answer, I think that for a year now, we've demonstrated that a pandemic is complicated, but at the same time, we've been able to implement measures to protect Canadians at several levels. As I said, we implemented extremely strict measures to protect Canadians from the importation of variants and COVID-19, either by prohibiting international travelers from March, imposing an obligatory 14-day quarantine, and with the new measures we've implemented on testing before boarding. And now we are looking into new measures, once again, to ensure the protection of Canadians. Yes, it is complicated. As I said, a pandemic is complicated, but we shall make sure that it is done the right way. It's not because the pandemic is complicated that we are not taking the right measures to protect Canadians. Follow-up question? Follow-up question. Do you think that some suggestions being made to the federal government and other governments, we've had a lot of such suggestions, for example, from the Premier of Quebec, do you think that some of those suggestions are too simplistic to implement? What is your judgment? Answer, we do openly welcome all proposals, particularly those coming from the provincial premiers, who are the ones managing the impact of COVID-19 on their citizens on a daily basis. So we understand their frustrations, which I also share, particularly those connected to people who still want to engage in non-essential travel abroad, putting at risk the lives of other people, and particularly with the new variants coming up globally that are even more transmissible and causing even more harm. So I am always open to suggestions. We are studying each and every suggestion to try to find the right one to protect Canadians and successfully discourage international travel, and also ensure a possible restart. This is an important balance that Canadians are expecting us to make.
News. There's a lot of evidence that suggests that better quality masks reduce COVID transmission significantly more than lower quality masks. Why is the government pursuing things like curfews and travel bans, but is putting little or no focus on getting people to wear better quality masks or double masking?
One of the announcements made by Health Canada a number of months ago by PHAC was around extra inserts in masks. We continue to talk about all the different measures that Canadians need to take in order to keep ourselves safe. I know how challenging it is. I know how frustrating it is. I know how long this winter is feeling for everyone. But we just need to hang in there a few more months. We have mass vaccinations coming for the spring that are really going to start changing the posture we have to take as a country. But in the meantime, wear a mask. Keep your distance, stay home as much as possible, avoid gatherings, download and use the COVID Alert app. These are all the things we know we need to do. We just have to hang in there a few more months to get through to the spring, and things will be much better.
Chris Reynolds, Canadian Press. U.S. President Biden is taking a pretty firm stance on the Buy American provisions that he announced yesterday, saying that exceptions will be granted only in rare cases that involve national security and a few other conditions. So given the different U.S. political climate compared to 2010, how much bigger of a challenge do you expect it to be to secure exceptions for Canada to those Buy American provisions?
Over the past 4 years, we faced an American administration that was both unpredictable and extremely protectionistic, and we were able, every step of the way, to stand up for Canadian interests, whether it was renegotiating NAFTA in a way that protected our auto sector, kept supply management that President Trump wanted to dismantle, that ensured our cultural exemptions, our intellectual property rights. We were able to stand up for Canadians. We were able to defend our steel and aluminum workers. We were able to continue to demonstrate how important it is to keep essential supply lines going, even during a pandemic when the temptation was to completely shut down the borders. We were there to be able to advocate for Canada's interests, and I can tell you we will continue to be effective in advocating for Canada's interests with this new administration. Obviously, President Biden has a lot of similar priorities to this government's, to Canadians, whether it's fighting climate change, whether it's building back better and creating good jobs for everyone. These are things that we're going to be able to work on closely with our nearest ally and closest friend.
Oui, bonjour, Monsieur Trudeau. Laurence Martin.
Radio-Canada, Mr. Trudeau, what should be done if immediately the European Union decides to block our Pfizer exports? Answer: that would be very disturbing, of course. We are communicating with our partners in Europe to make sure that the contracts signed by Canada be respected. I do understand that there are some political concerns related to some vaccines and some countries. For now, Canada is not involved in those European concerns, but of course we shall continue with our allies. From the very beginning, Canada worked together hand in hand with Europe on vaccines and on ensuring that everyone received vaccines. We participated in Gavi, COVAX, the accelerator tool. We are there working together to make sure that we deal with this pandemic globally, and we shall continue working hand in hand with our European friends.
We have, from the very beginning, worked extremely closely with European partners on vaccines, whether it's supply chains for ourselves or ensuring vaccine access for the world's most vulnerable peoples, whether it's through COVAX, through the Act Accelerator, through investments in Gavi. The work and the close working relationship between Canada and Europe gives me reassurance that the contracts that we've signed and the supply chains that we have established with European manufacturers are in good shape. We will continue, however, to work very, very closely and monitor and ensure that Canada continues to get all the doses that we have contractually signed for.
Follow-up question. But right now, can we exclude that possibility? Can you guarantee that the European Union will not block our exports? Answer: for now, I know that the European Union is looking into specific concerns concerning AstraZeneca. We do not have an AstraZeneca manufacturer in Europe, but we shall continue making sure that we have the vaccines we need in Canada to vaccinate our people. As I said, we are still confident that we shall have the 1 million doses, those millions of doses we need by March, and all Canadians who want to be vaccinated will be vaccinated by September.
As we know, we will continue to work closely with Europe to ensure that we are receiving the vaccines that we have signed for, that we are due. The preoccupation seems to be a little more around AstraZeneca and some of their European productions around certain countries at this point. We do not have at this point or in the near future sourcing of AstraZeneca coming from the European manufacturers. But we will continue to work very, very closely. Our job, our priority, our focus is on making sure Canadians get the vaccines that we need as quickly as possible, as reliably as possible.
Prime Minister Michael Couture with Global National. Examples of hardening the border have shown success in other countries like Australia and New Zealand. You now have a growing number of premiers that are begging you to do it. So I'm just wanting to understand, what is taking you so long to announce measures to limit travel both in and out of Canada?
We have taken measures since the very beginning, since a year ago, that Canadians seem to take for granted, and it's a good thing because we have lots of other things to think about on our plate. But as of almost a year ago, foreign travelers are not allowed to come to Canada. We brought in a travel ban very quickly. We also brought in strong mandatory quarantine measures that the United States didn't bring in, that Europe didn't bring in, that many countries around the world didn't bring in, because we knew that was something that we could and should do to keep Canadians safe. Furthermore, as we've seen variants expand around the world, we moved forward a number of weeks ago on further measures that put Canada near the very top in terms of hardened borders around the world. That is mandatory pre-boarding testing for anyone returning to Canada. The United States is actually looking at following suit on exactly that measures as well. So we already have some of the strongest measures in place, which is why the rate of importation of viruses is extraordinarily low. The vast majority of all of our cases in Canada come from community transmission. But obviously, even one case is too many on importation, and we are looking at even further restrictions on travel, which we are looking at very carefully to ensure that they're the right ones, that they're effective, and that they keep Canadians safe.
Hi, Mr. Trudeau. Mackenzie Grover, CTV News. There's a lot of negative headwinds and unknowns with vaccines right now. We've mentioned the EU. We've talked about AstraZeneca potential delays. And of course, the big one for Canada right now is Pfizer delays. How can you promise we're going to have enough vaccines by September if you can't tell us how many Pfizer vaccines we're going to have in 3 weeks?
I can tell you that as of February 15th, we will be back in the hundreds of thousands of Pfizer doses every single week. In my conversation last week with the top folks at Pfizer, they assured me we are very much still on track to receiving all the promised doses by the end of March. The temporary delay in Pfizer deliveries that are happening not just to Canada but to countries around the world are related to improvements made at their Belgium manufacturing facility, and once that is done in the coming weeks, they will be able to deliver even more doses to Canada and to countries around the world. We are very confident that not only will we reach our target of vaccinating all Canadians who want it by September, but we are very much on track to receiving the 6 million doses we committed to Canadians we'd be getting by the end of March, exactly on schedule.
Merci beaucoup. C'est ce qui met fin à la conférence.
Thank you. That brings today's press conference to an end.
All right, and that is the Prime Minister of Canada on this Tuesday.